we did a very large pragmatic trial of transitional care called COMPASS, or Comprehensive Post-Acute Stroke Services. And this is really focused on, it's a complex intervention focused on not only making sure patients get recovery services that they need, rehabilitation, but also secondary prevention. And one of the messages that we really emphasized was know your numbers. And that referred primarily to blood pressure, but also blood sugar if they're diabetic, and other, cholesterol. So what we did was look at the secondary outcome at 90 days, which is self-monitoring of blood pressure. So we asked patients, are you monitoring your blood pressure? And if so, how frequently? And so we had about 75% of patients who received this complex intervention who said, yes, I'm monitoring my blood pressure. For the 25% who are not monitoring their blood pressure, we wanted to see, well, what are the characteristics so that we can really focus on awareness and education in those groups of people. And so it turned out that it was patients who were younger, patients who were African American or Hispanic, and patients who lacked insurance who were less likely to monitor their blood pressure. But in addition to that, patients with depression and patients who did not have hypertension and other kind of classic cardiovascular disease that were less likely to monitor. So we feel like with this information, it's going to help us target messages to patients in our next trial, which is focusing on blood pressure management for the 6 months after discharge from a stroke, so that we can really assist these patients and make sure that they are monitoring their blood pressure. Because even though it may not be the same thing as better blood pressure management, it's a step in that direction. And the guidelines now are saying that home blood pressure measurements may be better than clinic measurements. So all arrows are pointing to the fact that we need more patients to be monitoring their blood pressures at home.